Hello, Mates Thrive Nation. Today's all about migraines, chronic headaches, and I've got the specialist of specialists, double board certified. He's an ENT specialist, and he's got a novel new technique to really deal with these symptoms. So it's a real privilege and it's a pleasure to have Dr. Kevin Smith on the show.
Hi, thanks for having me. I really appreciate it.
Brilliant. Now, tell me, how many people's migraines have you managed to cure with this new novel technique, which we will going to get onto, but we've got about 5-10 minutes. People are listening. They're on YouTube. We've got to grab their attention to say, hang on, if you have got migraines or chronic headaches, or you know someone that you love or care for has, there is a new novel approach to treating these.
There is. I have eliminated migraines in more than 5,000 people to date. The thing is, though, there are 1 billion people in the world that have migraines and can benefit from my novel procedure. As far as I know, I'm an ear, nose, and throat doctor, facial plastic surgeon. As far as I know, I'm the only surgeon that does this type of work. So it's very exciting, and I thank you for having me. So anybody out there that's suffering from any type of migraine headache, it doesn't have to be just a sinus headache. It could be a hormonal. It could be hereditary. I've cured families with migraines. It can be exertional headaches, cluster headaches. Any of those things can benefit from the information we're going to talk about today.
Yes, brilliant. Now, okay. So I want you to give us two stories, a female and a male, in terms of who came to you. And, you know, I've been in functional medicine 25 years now, and I'm often the 7th doctor that people see when they come to me with their problem. So you must sometimes be the 7th or the 10th or the 15th. People have seen so many doctors. But give us a really cool story, Dr. Kevin, about a female and a male that you've helped.
Certainly. Just to start out, one female had hemiplegic migraines. Whenever she would have her period, she would get blackout spells. She would get paralysis of her legs. She couldn't walk. She couldn't remember what happened. She had slurred speech, blindness in one eye. She's seen multiple doctors and was in Belgium doing some missionary work and had to be life flighted back over to the United States. They found me, came to me. I got a scan of the sinuses. I was able to identify these specific abnormalities in the nose that I know caused the problem. We did a procedure, and she's been migraine free, and all the other symptoms that accompanied her migraines are gone. All the blackouts, the paralysis, the visual disturbances, and all those things are gone. So it's was a pretty impressive and memorable case. Another case involving a male. This gentleman had had migraines for years, and he also had these blackout spells, but also would have some sleepwalking episodes, I'll call them, for lack of a better term. He would be at dinner with his family, get up, they thinking he's going to the restroom, and he would be walking the neighborhood for hours and not know it. He would drive a truck for work and wouldn't remember the day's work, would get in his car because he was afraid he might have hit something, would drive around his route to make sure he didn't damage anything. It got so bad, he lost his job, had to move towards his family because he was stuttering, having these headaches, having these blackouts, having these sleepwalking episodes, and just could not work, could not do anything. So he needed his family to watch after him. They found me, sent a scan in, I identified the problem, and he has done very well. The stuttering is minimal. He actually had 14 of the top 20 Parkinson's symptoms accompanying his migraines. They are all gone. The migraines are gone. And he just referred his wife, who started to have headaches, lost her job. And I just did her procedure about 6 weeks ago, and she's doing great as well. So those are two fantastic stories that are very memorable. They were devastating. They changed. They really impacted these people's lives. And now they're living their best life, and they're very grateful for it.
Incredible stories. Well done. And I salute you because you're changing, you know, just the fabric of society. They're really struggling with chronic headaches. I've been in practice 25 years. I've never seen headaches and migraines just increase to this dramatic degree. So it's on the exponential increase. But are these now how many like months or years has it been post-surgery that they don't have their migraines anymore?
Oh, the one young lady, it's been about 4 years now. And the gentleman I mentioned has been 2 years, but I have patients that have been as many as 15, 20.
15. So when did you start doing this procedure?
Well, I've been in practice 30 years. Initially, when I was doing this procedure, I actually didn't believe they were migraines, because you have to understand that I, along with other people that go to medical school, are taught that migraines are in the brain. It's caused by the vasodilation of blood vessels in the brain and so forth. So initially, when I was fixing these headaches, I thought that they were migraine-like headaches, I would call them, or migraine imposters, or I just didn't know what to say, but I had to put the word migraine in there to get more of those people to come to the office. Otherwise, if you just say chronic headaches, migraine patients see themselves as a different category. So I got them in and happened to be on television one day with a woman who had had migraines for 41 years, and she was 5 years migraine free. And during the show, I said, to all the listening audience out there, you can have access to my expertise by sending me a CT scan disc to my office. I'll look at it to see if you're a candidate. Lo and behold, nearly 100% of those scans had the abnormalities that I knew caused the headaches. And that's when I was aware, about, I don't know, 10 years ago, that I was actually curing migraines and not just migraine imposters.
But now you obviously didn't start as a migraine specialist or a neurologist or a headache specialist. Did you just notice and correlate, hang on, I've now fixed a deviated septum, or I've changed something with surgery, and all of a sudden it's like patient comes back and says, hang on, I had these migraines, or I had these chronic headaches, or I had this dizziness, and it's a lot better since the surgery?
Exactly. I was in a fellowship, my facial plastics fellowship, when I noticed that there was a gentleman we were going to see who we'd done a rhinoplasty and a septoplasty on. And he said that, I don't know what you guys did in my nose, but my headaches are gone. So, I kind of remembered it. And as I got into my own practice, I would see patients because I do a lot of sinus surgery. I had to ask them, do you have headaches? Oh, yeah, I have a lot of headaches. Actually, I have migraines. And I'm like, okay, well, we'll see what happens. It's actually the practice of medicine that I was doing. I've always been a very curious person, and I'm very observant. So I was very astute in doing procedures and watching the outcomes, doing the procedures and watching the outcomes. And over time, I just knew that I was making a very big impact. And I would go on television and I get flooded at my office with 30, 40 people saying they saw me and they had these chronic headaches and they didn't know what to do. They'd seen all these doctors, they tried all these things and have not gotten better. And one thing led to another. And the more and more you do it, the more and more you see. And then that television show actually catapulted me into knowing that I was actually eliminating migraines.
Sure. Incredible story. Wonderful. But now you get the scans, you get the CT scans of the sinuses, you have a look, you recognize that there are abnormalities, and then that gives you the indication that the surgery is going to help. Now, what percentage of those CT scans that you've said, okay, there are abnormalities, what success rate do you have when you do the surgery?
My procedure, I call it the Smith sinus migraine technique. It's a septoplasty. In its simplest term, it's a septoplasty when present. It's trimming of the turbinates, which are the air filters in the nose, and it's doing some sinus balloon sinuplasty when indicated as well. However, I must stress, my technique is much more detailed. It is much more intricate and much different from surgery done by other ENTs to help you with breathing or sinus problems. Now, the benefits of getting rid of the headaches and migraines are that you do breathe better and you do feel better because I am addressing the abnormalities in the nose, which is going to optimize that nasal breathing and reduce any headaches, migraines, sinus infections, and things that go along with nasal airway obstruction. But in order to really cure the migraine, it has to be done with my technique, and the success rate is 90%.
Sure. 90% now. So maybe you can just repeat exactly what you're doing. Are you at the sinuses? I mean, the abnormalities, what are they? Or would other ENTs, here in South Africa and Africa recognize that the abnormalities there and do the technique in a way that would be totally different? Or what is, you said septoplasty. How can someone listening out there saying,
Okay.
oh, I want to go to my ENT now, and they're in South Africa or they're in the UK, we've been downloaded in 159 countries. They need something. I mean, obviously they can send the podcast, get the book, The Migraine Imposter, but how different is it, and what exactly are you doing?
Okay, that's a very good question. You can imagine that one, ENT surgeons vary in their technique, their styles, and their skill level. Two, some would notice the abnormalities on the CT scan, and some might not. Some might discount it. Three, you'd have to know exactly what to look for. And I've had people tell me, oh, my ENT saw the abnormality, but he said there's no way that this could be causing 30 years of migraine. So they don't understand the correlation between nasal abnormalities and the migraine headaches. So it's an issue for people who are out there in the UK and South Africa, because I want to say the CT scan has to come through me to get the best chance of identifying the abnormalities, and then having the procedure done definitely has to be done by me because I haven't trained anybody in doing it. That can be difficult, I understand. So for those people who can't send it to me or can't come to see me, you can get assigned a CT scan, go see your ENT, tell them that you have the chronic headaches and migraines. Maybe you don't say migraine. I've told people this: say you're having facial pain and headache, because as soon as you say migraine, you're going to go into this channel where you're getting a MRI or a CAT scan of the brain. And I've had people come see me who've had 14, 20 CAT scans over the period of 20 years that are all normal. And in fact, 95% of brain scans done on migraine patients are normal. 95. The opposite is true when you get a sinus scan, okay? So I would tell them to get a sinus scan, go see the ENT, tell them you have sinus headaches, and see if there are any abnormalities that they can fix, and hope that they do a good job to get you well. I hate to say that because I don't want people to walk away from that experience saying, oh, I guess I didn't have what the doctor said is causing migraines because it didn't work on me. That hurts me. So if there's any way they can send a scan to me, please do. And then if there's any way to come and see me until I can train other doctors around the world, and that's certainly in the works, to train other surgeons around the world. I have my work cut out for me, and to train other ENTs to know about my technique and how to identify it on the scan, and how to do the procedure.
Okay, so that's in process in terms of training others, in terms of putting a manual or, a specific surgery book.
Yes, master class, that kind of thing. Yes.
Okay. All right. We got to get moving with that, Dr. Kevin.
Yes, we do.
How old are you now? You've been 30 years in practice.
I've been 30 years in practice, but I'm 64, but I tell you, I don't feel 64, and I'll be working the rest of my days on this because it's very exciting. I'm very passionate about it. I'm excellent at it. And it actually feeds me because it's helping people improve their quality of life.
But now, how have other ENTs said, oh, we've heard about Dr. Smith, and we're going to go and ask him what needs to be done, and go and train with him? I mean, surely the word is spread. You've been on TV already. Patients talk. I've done over 140,000 treatments in 25 years. They talk and they send people if you get results. So what's happening with your colleagues? How do they see you? Have they come in and embraced you?
Well, that's a very good question. I wrote a paper years ago about septoplasty in suspected migraine sufferers and submitted it, but it didn't get accepted. I sometimes wonder if it's because it's a topic that is breaking the norm. It's a topic that creates doubt, and it's a topic that if you don't understand it, you will reject it in some cases. I've reached out to neurologists to work with them, those who have expertise in migraines, and I've said, I'm sure you don't help everybody. Send those worst ones to me. Let's see if we can work together to help them. And I've been rejected by that too, saying that the information you're giving out is wrong. You cannot cure migraine headaches with surgery. And with that, I'd say that a neurologist doesn't specialize in the nose, so you actually don't know what I'm talking about. I'm the expert when it comes to migraine cure. Now, neurologists are the expert when it comes to migraine treatment, control, that sort of thing. And medications are good for some people. They don't work for others. Some people can't have surgery. They can't go under general anesthesia. They're not healthy enough. They need the medications and other things out there. So I would never say that medications aren't worth it. But for the majority of people who are healthy, who have migraines, they need to have the procedure because it's actually eliminating the root cause of the problem. I'm really big on the root cause of things. And this happens to be the root cause: a deviated septum, large turbinate, sinus problems, or combination of the above. All the procedures that I do are customized based on what I find on the scan. It's not a cookie cutter where you come in and you get the Smith procedure, which is the same procedure on everybody, because everybody doesn't have the same abnormalities. Yeah. So as far as embracing me, the time will come, I know that's going to come, where I'm just going to have to forge my way out there and take the hits that I'm going to take, but I'm prepared for that mentally, and convince ENTs and neurologists that as far as eliminating migraines, this is an ENT specialty.
Sure. Incredible. That's wonderful to hear. Now, if you take migraines overall, like now you've got to take their CT scan, you've got to check out if they've got the abnormalities, and you're getting 90% success rate on those that have the abnormalities. If we look at migraine sort of in its totality, how many of those migraine sufferers, like you probably get a CT scan where they don't have abnormalities and they still got migraine. So what percentage have the nasal abnormalities of total migraine sufferers?
Probably 98%.
What?
98%. Yeah, it's astounding, isn't it?
No, no,
It's
no,
astounding.
no, Dr.
About
Cribbett.
90, I
Come
mean,
on.
50% would be a good number, but no, it's about 98%. There's a handful of people I can remember where I just looked. And then years ago, I think those people who I did tell them that I didn't see anything, of course, I've evolved since that time. So as I circle back around, there may be things I can identify and go, oh, yes, I see it now that I didn't see earlier because I just too young. I didn't have the experience that I have now. And it just takes experience to look at these scans. I've seen some scans and initially with the initial screening going, I just don't see anything. But then I go through again and it's like, oh, there we go. I see it now. That's it right there. There's the problem there. I got it. And even when I do the procedure, there have been several people where I go, man, the findings were so minimal that they've done great. No more headaches, no more migraines. And I just learn from every case that comes in. I'm constantly learning and remembering what I see, how it works, what I do, how that works. And it's just a fun career. I love what I do.
But now what about the 10% that don't get well? What do you think the mechanism of action is there?
Well, that's a very good question. I do wonder what I might be missing because I know the root cause is in the nose. However, I also understand that migraine is head pain, and the head consists of the brain, the nose, the eyes, the mouth, the neck can refer pain to the head as well. So I have to really humble myself and say, it's not always in the nose. It could be something else. I've also found that in some people, and especially women, they get these scar bands and scar tissue in the nose that can also cause headaches because their nose volume is a little smaller, and they also have the hormones every month with the menstrual cycle, which causes swelling of the nose. But lately, I've come across a therapist that specializes in PTSD, and the light bulb went off that, wow, if you have a migraine for 30, 40 years, that's a form of PTSD. You're chronically stressed, you're in chronic pain, and it might be possible that the brain has established these neural pathways where even when I do the procedure, it's still perceiving or creating this pain episode. And so I've started to refer people out to this therapist for PTSD treatment to see if that might be a cause. So those are things that I'm doing. I'm keeping my mind open to figure out what is it in that 10% of people that I'm missing, or it's something else as a result of that long-term chronic pain that they've endured.
Yeah, great comment and investigation there. I mean, I've done a lot of neck prolotherapy of regenerating ligaments and stabilizing the cervical spine and using platelet-rich plasma. Many migraine sufferers have come in and done exceptionally well.
Great.
Based on this sort of premise and helping so many people, having done over 30,000 injection treatments here in the practice, do you think this whole process with the sinuses then and these abnormalities is affecting the autonomic nervous system? So if you take it, say, from the neck, you're affecting the vagus nerve and you're affecting the parasympathetic nervous system and downregulating the sympathetic nervous system. Do you think your procedure and these abnormalities is having a direct effect on the central nervous system and especially the autonomic nervous system?
I think it does, absolutely. The sensory nerve in the face and the head is the trigeminal nerve. So when you have these abnormalities in the nose, they trigger the trigeminal nerve, which then has a fire and go back to the brain. And there's a condition called cortical depression where I explain it's like when you look in the sky and you see lightning. It can be one bolt that hits one tree, but it can also be diffuse lightning throughout the sky that you see. So cortical depression is when that electrical impulse then diffuses into the brain after it reaches and comes from the nose, and it hits these other nerves and causes the aura that people have, the eye problem, the paralysis, the weakness in their arms and legs, the slurred speech, the stuttering. It's all a part of that cortical depression. So it definitely has an impact. And as far as the neck is concerned, I have lots of people with neck pain and problems that go away when I do my procedure. And I was talking to one of my colleagues, a neurologist, and he says, oh, absolutely. There is a cervical branch of the trigeminal nerve that goes posterior. He said, so if you're relieving that pressure point or what have you, you can certainly impact the neck as well. So it certainly has a role with the autonomic nervous system. And you think about it, with this chronic irritated focus in the nose, always firing, it keeps you in a state of fight or flight. You're never relaxed. You're always stressed and heightened and irritable. And it's just it's a horrible existence.
Mm. But now, how would the link be? I mean, what's happening there? You've got this septoplasty, and you're doing, you're treating deviated septums, and you're doing this balloon procedure. Now, someone
Yes.
has, like, they eat and they're totally intolerant to, let's talk about maybe an oxalate or leptin. I had Sally Norton on the show, they had Dr. Gundry on the show. They have something, there's a huge, rich, supply of nerve fibers to the gut. They have a reaction straight away. They get like a migraine, or a migraine, as we say it here. Now I'm starting to adopt the
Yes.
American way to say it. But
I like it. I
yeah,
like it. Migraine,
but
migraine.
migraine. But then all of a sudden, do you think there's some type of neural network that either can come from the neck, or can come from the gut, or can come from light, that then passes through this area where you are correcting the abnormalities, and you're releasing pressure on the central nervous system or the autonomic nervous system, that sort of like changes the circuit, so that if someone has that cheese or wine or that chocolate, or someone turns their neck, or uses their neck too much at a PC, that would normally have given them the migraine, but now you've released that pressure somewhere along that track, and now they don't present with it.
Right. I could talk to you all day about this. You are so intuitive. You are hitting on all the high points, and I'm just, my mind is just going with excitement. Absolutely. Let's talk about the anatomy of the nose, and let's relate it to the recent COVID outbreak. The easiest way to explain what I do is, if you've ever had the original COVID test, it hurt when they put the swab in the back of the nose. Why? Because there are structures called turbinates, which are very sensitive, but they're the air-conditioned coils of the nose. They swell and shrink in response to colds and flus and hormones. They also swell and shrink in response to chocolate, wine, things like that as well. So, but they don't like to be touched. So when you have that abnormality, namely the number one abnormality I treat, but it doesn't have to be present all the time, is a deviated septum. Why? Because the nose protrudes from the nose, from the face rather, and it can get injured easily. And it doesn't have to get broken. It just has to get hit. A baby's head in a mother's lap, an elbow during basketball or soccer, things like that. When you have that abnormality poking on the turbinates, then you get that referred pain. So I've had a woman, a young lady, who was 17 years old with migraines, but also had irritable bowel syndrome and cramping. She could not eat pasta or pizza. So she comes in after a third visit. She goes, Dr. Smith, my migraines are gone and everything's fine. But she goes, oh, but by the way, Dr. Smith, she said, I'm able to eat pizza and pasta and I'm not always bloated. My stomach feels so much better. So I made a mental note of that. Had another woman who, weeks or months after her surgery, my migraines are gone, Dr. Smith. But you know what's so crazy, Dr. Smith? I was like, what? She said, I've had constipation since I was 19 years old, and it's gone. And I made a mental note of that. So that had me on an investigation about what else are migraines associated with. And so when you read that and search that, you'll find that migraines are associated with at least 75 neurological disorders. MS, epilepsy, dementia, Parkinson's, Alzheimer's, ALS, cerebral palsy, autism, Tourette's, irritable bowel, Crohn's disease, retinitis pigmentosa, and the list goes on. So I took a deep breath and went, okay, But nobody knows the association. Why are migraines associated? But they know they occur with each other higher in a higher percentage than they do alone and with other diseases, these disease states. So the way my mind works is let's get some Parkinson's patients in here and screen them. If migraines associated with Parkinson's, then let's screen some Parkinson's patients. And I've had several come in, they have the same abnormality as my migraine patients. In fact, I just did a procedure on a gentleman who had headaches, sleep apnea, migraines, and Parkinson's with a horrible tremor. And it's been less than a week. He hadn't even been a week from his surgery, and he already posted on my Facebook page that his tremor went away. And I told him, I said, well, you have medications on board, the pain medicine. I gave you steroids for the surgery. We're going to let you go out a little further. But I don't think if I'd operated on his toe, his tremor would have gone away. You see what I'm saying?
I got you.
So the fact that I operated on his nose and the tremor went away, he said, in fact, I've forgotten I even have Parkinson's on the post. I didn't ask him to do this. I read it last night and almost cried because here's a gentleman who is almost forgotten he's had Parkinson's 3-4 days after his surgery. So all that to say is if migraines are related to all these conditions, then absolutely it's tied into the autonomic nervous system. Because when you think about the body is made up of nerves, and every cell in our body is controlled by nerves. If there's an irritated focus in your nose, constantly having you in a fight or flight stance, it has to affect the rest of the body in some way, which then goes back to that cortical depression. In some people, they get visual disturbances. Other people might get constipation and not know why they're always constipated and might not even have headaches. There is a condition called silent migraines where you don't even get the headache, but you can still have the abnormality. And that abnormality can be stimulating this irritated focus that's going to your brain, disseminating through your body. And somebody gets cramps, another person gets Parkinson's-like symptoms, another person has tremor, another person stutters, another person has facial tics that they don't know where it originates from. So my thing is for all those people, you need to get a sinus scan. I think down the road, we're going to be screening people with sinus scans to check for these abnormalities because you don't know who's going to develop a migraine, who's going to develop ALS, who's going to develop dementia and Alzheimer's and Parkinson's and MS and epilepsy, and you don't know. So it's going to be a screening process whereby you look for that, correct that, and you eliminate a lot of disorders in this world, or at least influence them.
Sure. Incredible. Now, what's happening with the facial structures? I know if I just look at my kids, they both need orthodontics, and there's teeth crowding, and just the palate is smaller than before.
Okay.
Are you seeing abnormalities in the facial sort of structures and in the sinus structures increase? And what does the research say about that? Because it then would indicate that something's changing the autonomic nervous system through facial structures. You're addressing those things, but it seems like sort of structurally our phenotypes are changing.
How old are your children, if I may ask?
My son is 20 and he's gone through it, and my daughter's 8 and she's going to be starting the process.
Okay. The face, this is a very good question. You have very good questions, and I appreciate it. I love it because facial structure, you mentioned a couple things, facial structure, teeth, that kind of thing. When your nose is partially or completely obstructed and you don't get proper airflow, then the sinuses don't develop. When the sinuses don't develop, you can get malar hypoplasia where it doesn't grow out. It has more of a flat appearance. You can get teeth that grow crooked because your natural brace, as much as people like braces, your natural brace though is to be able to breathe through your nose so that your mouth is closed and your tongue rests along your teeth. The longer you can do that, the more often you do that, your teeth are going to be pretty straight. When you can't do that and you're chronically mouth breathing, now your tongue is not against your teeth. The teeth have nothing to brace it naturally, and they can tend to grow off and cause bad teeth or crooked teeth. So the first thing I would say would be get a scan of your children's sinuses. Have them examined by an ENT. Send the scan to me. I will tell you what's there, what needs to be done, because in the case of your son, he's already 20. So his facial structure is already developed pretty much. In the case of your daughter, it's developing. So you would like to address any large adenoids, any large turbinates, any deviated septum that might be impairing the ability for her to breathe properly through her nose, which would then correct the teeth, the mouth, and just overall just have her feel better. So yes, there is a connection with that. And why is it that more and more people, the structures and the phenotypes, like you say, might be changing? We're becoming more active is one. Maybe we're damaging our noses too. Maybe the hereditary factors and are becoming more prevalent now than before. I don't know why. It could be the food, it could be the environment, it could be the heat, it could be anything. You know, it's all interrelated. But that's a very good question, and I hope that the answer I gave sort of helps you understand,
Absolutely.
at least from my expertise, what might be going on.
But if you take, like, if, I mean, it would love it to be a study of take newborns and see what's happening there, if those abnormalities exist, because now, is it because genetically it's changed, or we're doing more C-sections, we're not doing vaginal births like we used to? And then you take a fall, then you need another surgery to ensure that you haven't done damage to the turbinate bones or the sinus structures, and then you take another fall 5 years later, then you need another surgery. I mean, it seems seems like the gospel. It seems too good to be true. I mean, it seems like if we just get these nasal structures in the right place, then the whole autonomic nervous system and things change dramatically.
Well, it's true. When you look at the nose, it's adjacent to the brain. It's right there. It's right below the brain. It's a protective organ. It's right there. It's sensitive. It's highly sensitive. And I think it's highly sensitive to protect your eyes and to protect your brain. It protrudes from the face. The first trauma to the nose is coming through the birth canal. So when I ask people if you had a history of trauma to the nose, and they go, no, I don't. I said, well, were you a forceps delivery? Or I'm trying to get information. Did your mother have to push a long time, even if you were a C-section? Was it 12 hours of pushing before that? Or was it planned C-section? So there's all that factors in that could damage the nose and cause these abnormalities. Yeah, it's
crazy. I mean, I'm just thinking about, Dr. Smith, I'm thinking about the environment. You know, you got mold, you don't breathe through your nose when you're a kid. All of a sudden, that causes major problems, facial structures. You know,
yes.
you're in a place where there's like biotoxins, you don't breathe through your nose properly, I mean, there's just so many reasons that if these structures don't develop properly, or they get damaged along the road, you're in trouble.
You're in trouble. You know, you bring up some very good points. Let's just talk about, if you damage your nose and you're exposed to these toxins or fungus or things like that, then you have a less optimal way to clear those things from your sinuses. The sinuses have the villi in the sinuses that sweep mucus from the sinuses into the nose. You swallow it, and that's supposed to be it. But if you have an impaired ability to clear your sinuses because you're not breathing properly, then that bacteria or that fungus or that toxin takes another circle or two around in the sinuses, and that's in a very warm, moist environment where they can multiply. Now you're getting to the chronic infection. Now you're getting into edema and sinusitis and can't breathe, and now polyps develop. And it's all related to the ability to breathe through the nose. So you're exactly right. The other thing about having multiple surgeries, the thing that I do when I perform a septoplasty is I'll take out a significant portion of the septum because it's made of cartilage in the front, but bone in the back. And so I'm almost ensuring that if you get hit in the nose again, there's nothing there to cause another spur or deviated septum, pretty much. So that's one of the things with my technique that I do is I'll remove a pretty significant part of the bone so that I can ensure if you get hit in the nose, you might break the front part or damage the front part, but that rigid bone in the back or in the mid part of the septum, it's cushioned. There's nothing there.
But I mean, ENTs, you know, I've been working with ENTs for a long time because I've seen more temporomandibular disorders here in South Africa and lectured on it all over the world than anyone else that I know. You know, a lot of injections into the joint and that. And a lot of them have sort of deviated septums, had surgery by ENTs. It hasn't touched their migraines or their sinus headaches. So are you
And
structurally changing things? Are you changing the mucosal membrane? Are you, I mean, I mean, if you're talking about these numbers, we're talking, Dr. Kevin, this is going to exponentially increase to a degree that we're going to have to somehow multiply you at a rate
I,
that's, no.
I mean, long after I'm gone, it's going to have to continue to multiply. There are 1 billion people in the world that have migraines that can use what I do. So I've got to train ENTs at different medical centers, different medical schools,
Yeah.
so that the whole group can understand how to do it and be able to access more patients.
But why are these
When
ENTs
you
not seeing any type of change generally with migraines? I mean, if you think about the technique
no
you developed, I don't know if it
no
was God inspired or it was totally
it
revolutionary that you decided to
it
do things differently, but why are they not
I
seeing the
did.
changes?
Well, I don't think people are inquisitive enough and willing to let go of the dogma that we learn in medical school and the dogma that's out there. It's just perpetuating the same thing. And so it always fascinated me that when patients would come in with these horrible CT scans and they had seen 2 or 3 ENTs, I would ask them, what did your ENT say? And she said, well, they either saw something on the scan or they said it was essentially normal. And if they saw something on the scan, when ENTs hear the word migraine, they go, oh no, you need to go see a neurologist. I don't want to, they don't want to assume that responsibility of giving somebody hope that they can get rid of it. I, on the other hand, initially starting out, I'm an ENT surgeon. If you come in with a complaint and I see an abnormality on the scan, I'm going to fix it. And we're going to see what it does. That's how I got to where I am today. I'm a surgeon. I'm a fixer. I'm not well, I see something on the scan. Let's give you some steroid and some antibiotic. I'm not that kind of person. If you have a problem, now if you don't have a problem, then I won't need to do anything. But if you have a problem and you have a problem on the scan, you're going to get a procedure. And the procedure, by the way, takes an hour for me to do it. It's covered by insurance here in the United States. It's 90% effective. No medications, no repeat procedures, no toxins injected, none of that. But it helps those people that I find the abnormalities in. And of course, if they don't have it, then they need to get other things done that can help tremendously. Like I said earlier, the medications, the treatments, the Botox, they're all very helpful for some people. So I'm glad we have that.
Sure.
But the
Now
root
tell me,
cause,
out of those people who don't have migraines that you've done CT scans on, how many of these abnormalities exist in a population? If you take a group, has this been studied or looked at, say,
oh,
300 people?
absolutely. It has been. The incidence of migraine, I mean, the incidence of a deviated septum runs anywhere from 40%, I've heard up to 80%. So people have them. And so, again, there's nothing to do about them unless they're having a problem.
Yeah.
Some are mild, some are medium, some are severe. I've had people with severe septal deviations. And I've asked them, do you have headaches at all? I said, no, I don't get headaches. And I'm surprised, but even in those people, I often think that if a septum is that severe, it probably lacerated the nerve or the turbinate or something and damaged it so bad that they just don't feel it. They just can't. I mean, because it's horrible and they don't have any pain or anything. Yeah.
No, but I mean, like if you had to take a group of 500 people and they
Yes.
had no migraines, and then you
Okay.
had to scan them, would some of
Yes.
those 500 have the abnormalities that you would normally fix
Oh,
that did
absolutely.
present with migraines?
No, it'd be about 40, 50%. Yeah. Or more.
Sure. Wow.
Exactly. That's the incident, but it depends on the degree. A deviated septum can be very minimal to very severe. And so everybody, to a certain degree, I say that a normal septum is relatively straight. I mean, I could find something deviated in it because it grows and it gets bumped, that kind of thing. But yeah, you might see up to 40, 50% of those people with a deviated septum to a varying degree. And even if they don't have symptoms, then that's fine. Then you don't need anything done for it. Yeah.
And
Very
now
good question.
are you cleaning out the mucus like membrane? Are you changing the structure? Are you cutting away? Are you taking things out? I
That's a
mean,
very good question. Again, I am doing what I call a normalizing procedure. I'm making your nose normal. People with migraines have abnormal noses, in my case, in my practice, that cause the pain. So what I'm doing is nothing abnormal. It does require a procedure. It does require surgery. However, my surgery is making the septum normal, the turbinates normal, the sinuses normal, so that then your nose functions normally and you don't get the severe headaches. You don't get the bad sinus infection or frequent sinus infections. You don't have sleep apnea anymore. You don't have ear pressure or pain or watery sensation in your ears or vertigo or um, ringing in the ears, tinnitus. All of that's related to the nose being obstructed. All of that.
I mean, it's incredible. I mean, I've been in practice so long, people get hormonal headaches and premenstrual headaches and
Yes.
premenstrual migraines, and somehow you're
Yes.
short-circuiting this entire process through the nose. It's
Well, the nose is very active and dynamic. When someone has their menstrual cycle, they're retaining water, the turbinates swell, and if you have a mild deflection of that septum, you're going to get contact, you get the headache. Once the menstrual cycle goes away, the turbinates shrink back down, and you don't have a headache. So that's the explanation for the hormonal migraine. And those who have triggers related to, let's just think about the triggers: food, weather changes, uh, exposure to smells. That's
light.
nose. And that's nose and light. One thing I've always said is, if those are the triggers for migraines and you think that migraines are in the brain, I have to challenge you, because do you really think the brain is that sensitive where a smell or riding in an airplane or having a change in weather would cause a problem in the brain when the brain is surrounded by a skull and cerebral spinal fluid? It's very well protected. So just that alone makes you question and go, no, I think if weather would be more apt to affect sinus cavities that might be obstructed, and they can't equilibrate the pressure on the atmospheric pressure to the pressure in here. And when there's a pressure differential, that's when you get the aching in your face.
Absolutely incredible. Let's talk about
So
risk.
anything you can do to reduce inflammation
Yeah.
helps migraines, helps. All of that helps. The diet changes help. The anti-inflammatory things that you give them help. It does, because it quiets down those turbinates. It minimizes the swelling, and the headaches and the migraines and the sinus issues get better. All of that helps.
Brilliant. Brilliant. Let's talk about risks of the procedure. Are there any risks? I mean, obviously surgery, there are risks, but have you seen anything, where people's symptoms have, worsened by your procedure?
Well, the risks include bleeding from the turbinates. I tend to burn them lightly with a cautery unit to keep them from bleeding, and then people have to be very careful not to do any strenuous activity for 2 weeks. You can get a hole in your septum from having a septoplasty, and if you do, it's a small hole and doesn't cause any problem. I've had a couple of smokers, however, who had holes develop in a critical part of the septum, and they were bothered by the sound of their breathing at night, whistling while they sleep. And you just put a little silastic button in there to close it off, and it solved that problem. And then there's the issue of scar tissue. You can get scar tissue in the nose, and women tend to form it more so, young women, than anybody else that I operate on. So you really have to be careful in doing the procedure. The scar tissue can cause headaches. And we know to look for it at my office and then take care of it in the office at a post-operative visit, or take them back to surgery to take care of it. And then that usually solves the problem. But yes, those are the risks. I've had one guy, they talk about septal abscess or septal hematoma, blood between the mucosal flaps after I do a septoplasty. That's happened once or twice. I can recall in 2 people that I had a septal abscess. You aspirate it, you put them on antibiotics, it resolved. There were no long-term consequences to that. And even if you see a bulge right after surgery of the septal mucosa at a post-op visit, I've aspirated and got a little blood clot out or something. That would be a septal hematoma. That's pretty much the more common things.
And what about their symptoms, like their migraines, like worsening at all or exacerbating any other symptoms? Is that a possible risk? Because I know I'm going to get questions about that.
It is a possible risk. However, that would be very unusual. Again, the few that I've had who have stated that their migraines were worse, I usually send my office manager in, and she does a very good job of questioning. And when she gets down to the nitty-gritty, it comes out from these young females that they are better. They are better. They might still be having some migraines, but they're fewer, less severe, less frequent. And again, that goes back to that PTSD component. I don't know how much of that is playing a role in that when it comes to some young females. You know, I don't like to say this, but there might be when you have chronic migraines, you get all the attention, so
Of course.
you wonder what part of that. And I always say that for last. I don't ever accuse somebody, and I don't even accuse anyway. I just say, let's see if a therapist might be able to help. There may be some other dynamics going on whereby you telling me that you're worse, but are you?
Yeah. So at the end of the
Yeah,
day, the risks are really low. I mean, you've done thousands and thousands of
there
procedures.
are.
Are you talking like a risk, something like that, like 0.1%, or are you talking about
Yeah,
like one out of
yeah.
1,000 or what?
Yeah, 1 out of 1,000, something like that. Yeah, to have any
Okay.
problems like that. I do have some bleeders though. It might be more frequent. That might be 2 out of 100, 2%. Maybe might have a bleed at some point. It's very rare, but they could. Somebody bends over, they forget not to bend over, and they start bleeding, or maybe they took an aspirin or an Advil thinking that it was okay to take it, and it thins the blood. So we have people
Yeah, but
stop
that's
all
not a
those things.
long-term side effect at all.
No, oh no, not at all. No, there are no really long-term side effects that I can think of. No. Mm-mm.
Okay, brilliant. Okay, we've come to the end of the show, but give us a message of hope with regards to how you're going to get this technique out there, and sort of what are your channels specifically. I mean, 48% of our listeners are in the US now. So,
Mhm.
my
Mhm.
mentor, Dr. Ross Hauser, taught me polar therapy, sits in Fort Myers. So he sees a lot of head and neck issues. But,
Okay.
just tell us the pathway forward that people can engage. Because, I mean, at the end of the day, you're going to be inundated. You've got
Yeah,
sort of one
I like
brain,
that.
two hands.
I like it. That's okay. Yeah. So the thing I would say is people in the States can certainly call the office at 713-795-0600. And the website is kevinsmithmd.com. I have dozens and dozens and dozens of videos on my Facebook page, which is Smith Center Otolaryngology. But yeah, call the office, get a scan, send it to me. I'll report back to you and let you know what's there and what we need to do to get you well. And that's for any type of migraine or chronic headache, any type. For those people, even out of the country, I have people that come from other countries, Mexico, Canada. I had the great Steve Harvey, who's a celebrity here, sent me his business partner from Dubai, took care of him, and they flew us out thinking that they might want to open a clinic in Dubai. So I've been out there. So people come from all over the world. So that's available if it's available to them. But please know that the plan is to develop a training program to train other ENTs, to train them in how to identify the abnormalities, how to formulate a surgical plan, and then how to do the surgery. So there are three critical steps that have to be done. And I'm the type of person, it has to be done right. I have to teach it right. Because I don't want patients. It's all about the patients. I don't want them coming in and having a procedure where somebody's not adequately trained and then leaving thinking that, oh, well, after all Dr. Smith said on the podcast, my migraines must be due to something else.
Sure.
Yeah.
Sure.
Yeah.
And are there any ENTs that are close to being able to do this? Like, are we talking
Not that
months
I know
away
of.
or
Yeah, not that I know of. No, it'll probably be a couple of years, to be honest.
a
Yeah.
couple of years? All right. Okay,
Yeah.
Dr. Kevin. Give us a message of hope with regards to just the future of treating migraines and just people that are like absolutely depressed or in despair. Because,
Yes.
people don't understand, like if you've got foot pain or ankle pain, I've done a lot of that. There's a lot you can often do to take a painkiller or something, but when it's in your head,
Mm-hmm.
it
Mm-hmm.
affects your thinking and it just affects everything. So give us a message of hope.
Here's the message of hope. I know that inflammation causes swelling in the nose, and if you have abnormalities, that can lead to migraines. So if you could get on an anti-inflammatory diet, do all you can to help control that portion, you're just going to be healthier in general. That might help. The other thing is, please know that the root cause of migraines is in the nose, and it's in the form of abnormalities. And if those can be identified and fixed properly, you can eliminate a significant amount of migraines and chronic headaches, if not all of them. So that is the message of hope. There is an answer. There is a cure. There is. And I'm the one to do it right now, but I certainly want to train other people and have other folks out there to help the masses that need to be helped.
Brilliant. Well, I want to declare favor and blessing over you that you would rise up strong in your calling. You're a courageous medical doctor. You're a courageous man to stand up and do novel procedures and to really put your life and your family on the line, really to try and help thousands and thousands, if not, well, you said a billion. So
Yeah,
you've
billion.
helped thousands. You've 5,000 people that you've already helped and changed their
Yes.
lives, So well done to you. And hopefully we can meet in person. I've studied the head and
Yeah.
neck area for many years, lectured on the head and neck area. So I'd love to embrace you one and bless you. And hopefully you come to South Africa. And I've got my business mentor who's in Austin, Texas. So hopefully we can
Oh,
get out there. But
oh,
yeah,
great.
just absolutely want to bless you and bring favor upon you.
Well, thank you so very much. That means a great deal to have somebody that understands what I'm doing and how I'd like to do it and really listen to me and really feel the fact that I'm passionate about this.
Yeah.
Thank you so very much. And I hope and I know that we probably will meet in the future and do some awesome things. So thank you so much for having me on the podcast and for all you do with your podcast. You're doing some great work and following your passion as well. And I wish you abundance as you continue to do your great work.